So, any questions? Please.
A lecture. Is the morbidity and mortality in diabetics, as opposed to normal glucose level, is it the result of glucose direct result or glycated molecules, or is it the result of oxidative stress, which antioxidants like olive oil will reduce it?
Well, I would say it's both. I mean, for long-term microvascular complications, glycosylation of proteins, of course, is one of the major mechanisms for eye complications, renal complications, and also for cardiovascular complications. But in terms of the oxidative stress, chronic inflammation that are directly related to hyperglycemia, and I think those processes, of course, contribute to both short-term and long-term complications of type 2 diabetes.
Other question? Oh, I wanted to ask you a question, Frank. We have the problem that for the industry, the production of ultra-processed foods or very inexpensive products is very convenient for the industry. Even they take advantage of very cheap buying matters, and then they sell it at a very inexpensive cost. And what do you think are the best ways of addressing this problem that is deteriorating the healthiness of the diets all over the world with respect to education and also structural interventions? What do you think that should be done?
Yeah, certainly the proliferation of ultra-processed foods has become a major problem globally. I know that in the US, 60% of calories consumed by children come from ultra-processed foods. And of course, those foods are inexpensive, palatable, and widely accessible. And so I think that, as you said, we need both education and also structural changes to reduce the consumption and manufacture of ultra-processed foods. The main issue is the toxic food environment or obesogenic food environment. And of course, it's very difficult for individuals to change that. It does require the combination of government regulations, policies, and also the demand by consumers to change that. And in the US, soft drinks or sugar-sweetened beverages continue to be a major problem. But soda taxation has, I think, played some role in reducing sugar-sweetened beverage consumption in some cities in the US and in Mexico and some other countries. Soda tax has been very useful in reducing consumption of sugary beverages. So that's just one of the examples how government policies like soda tax can contribute to improved food environment.
There are some voices in Europe, in the European Union, to label the foods according to their glycemic index. What do you think about that?
Complicated issue. The glycemic index is a ranking of carbohydrate-containing foods according to their ability to reach blood sugar. There are many factors that affect the glycemic index besides the amount and the type of starch, how you cook it, how long you cook it, and what kind of things you add to your meals. All those factors can affect glycemic index. I think it's very useful especially from a research point of view. But whether it's useful from consumer point of view, I think is still debatable because you can easily manipulate glycemic index of the food by adding fructose to the food because fructose has lower glycemic index compared to other sugars.